Good afternoon, everybody. Healthcare is a field which has been deeply affected by the COVID-19 pandemic, as I'm sure everybody knows, and it's also a field which has seen a huge surge in interest over the past few months, as pretty much everyone in the world has looked to the sector for answers and solutions to the problem that we're facing at the moment. My esteemed guests are all vastly more qualified than I am to discuss these issues, so I will be handing over to them shortly. But something that I'd like to say, just as a simple layperson, is I think that it's fair to say that over these difficult months, it's been increasingly clear that the pandemic has accelerated change and innovation in a number of fields, but I think that no field has been affected more than the healthcare sector, because it's had to play a dual role in this crisis. Firstly, it's been a provider of primary healthcare to people who need it, to people who need treatment. But at the same time, people have also been looking to the healthcare sector for solutions for the future, for treatment, and eventually for a way of eradicating COVID-19 entirely. So I'd like to start by asking Jan from EIT Health what I think is a very simple question, but it might have a more complex answer. We shall see. Do you think that at some time in the future, the healthcare sector is going to look back at this year as being a pivotal year? Because it's obviously a year in which we've had so many challenges thrown up, but it's also one which has allowed for the acceleration of, and even the creation of, a new dimension in healthcare and the way that we look at healthcare and the role that it plays.
Hello everyone. First of all, thank you very much for having me on the panel. Well, you've given already a lot of the answers, Craig, so I would fully agree. I do think we will look back at this as a turning point, maybe for a few reasons. I think we have, of course, realized, and we all remember especially now in Europe, the especially terrible pictures that we saw from Spain and from Italy and so on in the earlier days. We have been really poorly prepared, right? And I think partially it's maybe excusable, but partially not, I think. I believe that also the European Commission back then, in light of the SARS and MERS outbreaks in Asia, had made very clear recommendations, for example, on stockpiling protective equipment that I don't think have been observed anywhere. So I think we will see this as a moment for greater preparedness for such events, and that concerns capacities, protective equipment, but also other elements like lab capacities and so on. But I believe what is maybe one of the key elements that we will see is that, as you said, Craig, it now unleashes, I think, a massive acceleration in the space of especially deploying digitally enabled solutions in health, which actually have been on the horizon for long, but we've seen a lot of adoption problems for various reasons, maybe patient acceptance, maybe healthcare professional acceptance. And now what we have seen in COVID times was also a breakdown on what I would say the continuity of care for also non-COVID patients, right? That lost accessibility to healthcare facilities. And we were often not able to use the means that we actually, from a technological point of view, had already available. So I think when we're going to be looking back at this, we will hopefully see this as a moment where not only a lot of innovation will come forward, but its adoption will really kick in. And hopefully also now the policy frameworks will be created to support this acceleration in every relevant field, in the area, of course, of reimbursement, but also in terms of financing, also in terms of data regulations and so on. Maybe we'll speak about that later. So in short, yes, we will look back at it as a turning point.
Data is indeed one of the areas that we will look at a little bit later on. If I can turn to my three guests in Poland. Anna, I think I'd like to ask you. I mean, Jan has just mentioned there that this caught us unprepared. You know, is it fair to say that we were not prepared for this crisis?
Hello, everyone. Yeah, and again, also thanks for having me here. I'm sure we were not prepared for the crisis. And honestly, I'm afraid we are still not prepared for what is going to happen next. So I've read many articles about how hospitals can prepare for the so-called second wave, which, to be honest, will not come because it's always the first. I mean, it's been the first wave from the very beginning. So we are still getting more and more COVID cases all around the world. And what I think that now we are still in a deep chaos, that I don't know what it's like in the rest of the world, but if I'm not wrong, it's just really similar to what we have here in Poland. We still haven't got any system solutions that will really enable the whole country to work properly, both in the healthcare system and in the school systems, universities, and employers as well. So yes, we have learned a lot, but there is still a lot we don't know, and many things will have to change, but I don't have a feeling that they have changed so far.
Okay, thanks for that. Thanks for your opening thoughts. If I can turn to my guests in the studio there in Warsaw. Mikhail, I think I'll ask you. You know, Anna's mentioned that, you know, Poland has perhaps, when it comes to the state, has not dealt with the crisis perhaps as well as it could, but there has been, you know, quite a bit of innovation coming out of Poland in terms of solutions. You know, I'm thinking of you know, Biomed Lublin and the plasma drug that they're working on, and there have been other things as well.
To this panel, and I believe, you know, coming back to your point, whether the crisis caught us unprepared, I think this is the virtue nature of crisis. It always catches us unprepared. But looking a bit into the positive side of this, I mean,
That's where I'd like to try and, you know, move the conversation as much as possible, I think, this afternoon, you know, try and focus on the positives.
Yeah, so undoubtedly there is a huge mess created by the crisis, and especially in healthcare. But on the other hand side, there's a strong stimulus for, as you said, for innovation. And I believe this is one point, and another is that it just revealed how science is important these days. So now the scientists become heroes. They become, you know, first. They hit the headlines and in press, in media. And everyone is looking forward to seeing a real breakthrough in either treatment or prevention of the disease. So this is the consequence of this crisis, that we understood how big the unmet needs in healthcare sectors are. But on the other hand side, we also stimulated to enormous extent the innovation. And I think looking at the general concept of this session, of this conference, is just it would be great to start thinking how this part of the world, the emerging Europe, could sort of get into this train of development of new potential therapeutic solutions to become players in the global healthcare sector. So I think this is a great opportunity for Polish scientists and for Polish sector just to catch on this train, and then knowing that the healthcare system is now more open to innovation and even more open to partnership than it ever has been before. So I think this is a great moment to do this.
Okay, if I can turn now to your colleague in the studio there. Do you think that enough investment is being offered to the healthcare sector, you know, particularly in this region? I mean, obviously, you know, there is a lot of money around the world that's being thrown at primarily trying to find a vaccine. But does that kind of, remove from the fact that we also need investment in other areas as well?
Well, hello, everybody, and thank you for the invitation. In terms of investment, healthcare sector is kind of a sector, it's never enough. So the COVID or the pandemic was kind of a stress test, which I don't think we really passed very well. And it is visible everywhere, right? Long waiting times, some challenges with treatment of COVID patients. Jan mentioned postponement of treatment of non-COVID cases, which creates risk to patients. So I would say definitely not enough money generally in healthcare sector, especially public. So it was exposed very much. But there are some silver linings in Poland, especially because 4 years ago, for instance, telemedicine or remote consultation with a doctor was, from the regulatory perspective, really not allowed. And from ambulatory perspective, in my company today, telemedicine is a key word. I can tell you that yesterday, 55% of our consultations with the doctor were delivered remotely, either by phone or chat. Last year, 5%. So innovation in terms of the real absorption of virtual care is massive, 10 times more. And it would not be possible if there were no favorable changes in regulation for us, for ambulatory, especially business. Because in the beginning of the year, electronic prescriptions, electronic sick leaves were enabled. Recently, electronic identification and authentication of patients, which is the first step for virtual care. Electronic referrals are being tested now. And till the end of the day, we hear that we should have interoperability of data, medical data. So we should have some standardized, or at least to some level, standardized electronic health records, which opens space for further innovation. And for me, innovation is not just technology. Delivering process or delivering care is more even about processes and technology supporting the care. So to introduce this massive, I would say even transformational change, we had to implement totally new care model. We had to integrate telemedicine into patient care paths, adapt all clinical procedures, introduce triage, primary care, and so on and so forth. So the change was really huge. And we have learned a lot. For instance, one of the key learnings is that telemedicine is not enough really to take care of the patients. Telemedicine is important, but should be integrated with all other services available in the clinic. And this integrated model delivers the best results for patients and is the most efficient from cost perspective for us. And what is very interesting when we look at the patients, what they accepted this huge change, it looks that they even like it because our NPS score is today 10 points even higher than last year. Thank you.
Yeah, and you were nodding vigorously there. You clearly agree with a lot that's just been said.
I absolutely agree with what has been said, and I just wanted to underline that, I mean, EIT Health is a sort of innovation platform that is supporting a lot of also more early stage ideas. We see a lot.
You've obviously seen a lot because obviously, EIT Health is a complex network across a number of countries. So you've obviously seen, different examples in different countries of what works and perhaps what doesn't as well.
We are seeing a lot. And I think while maybe, and I was hinting at that at the beginning, maybe in terms of political alignment at the very beginning, the EU has not necessarily been at its best, but I think the cross-national networks in science, technology, innovation, I think they function, and we've seen a fantastic collaboration. And I believe what would be really good now is to see how we can identify some of these great cases that you just mentioned, where we see increases in patient outcomes, maybe also patient experience and satisfaction and so on, and try to elevate that to support also replication in other areas in Europe. I think this is a fantastic opportunity, because we're all facing similar issues. Things are being tested in different places, and we should try to elevate these great stories. Also, many of them coming from the emerging Europe region that we are focusing on here today, and see that we can expose them across the continent and accelerate adoption.
Anna, Warsaw Genomics, what kind of challenges have you faced, in particular, over the past few months?
It was one challenge, and it's COVID, of course. Okay, so maybe we'll just come back to the basis why you're asking the question, because we switched to COVID testing, and it took us more or less 1 week.
And this is something that, healthcare companies have done across the world. They very quickly had to switch to something else.
So it took us a week, more or less a week, between when we made the decision and we did the first testing. So I would say that if you have a deep background, so if you have good systems in your company, if you've got good employees, if everything is working fine, then it's not that difficult. Okay, but actually the main difficulties we had were and are still connected with, sorry again, but with the national systems, which are not really well coordinated. So let's say there are almost 200 labs in Poland doing the COVID testing at the moment. And there is a national system that is supposed to coordinate the work of all the laboratories, but it still really needs a lot of adjustments, both for the labs and for the medical doctors to really understand how the system is working. So it was really easy from the inside perspective. There wasn't much we had to change within the organization, but it's really not easy when you have to adjust from working as a totally independent organization, then switching to be a part of something which is still being rebuilt and is within a constant change, and you don't really know when all these adjustments will end. So it's like every day brings some new findings for us. So the IT systems are being changed every week, and we have to adjust to it. So, we really have to be very flexible, which is fine, of course, because we are also learning and we are developing. But I would say this was the biggest work we had to do. Not to change the company, but to adjust to the system around us.
Okay, well, thank you. If I can come back to the gentleman in the studio in Warsaw, Mikhail, if I can ask you, do you think that coordination at state level, perhaps in terms of, research, in terms of collaboration between, different companies who are, perhaps not always pulling in the same direction, do you think that there's been enough central, not necessarily control, but enough central direction in terms of where resources should go?
So I don't want to speculate on the public funding of research too much, but
not necessarily funding, because investment is not always about funding. It's also about what happens to other resources.
Sure. So on the one hand side, it's a huge challenge for the industry just to put all the resources needed to create a preventive vaccine or a treatment for COVID, and to this end, this is completely unprecedented. So now the company like ours needs to invest in trials of the vaccine, and yet in the same time to upscale potential production capabilities to potentially produce billions of doses. So taking a huge risk on one hand side. On the other hand side, sustaining delivery of drugs that may be in increased demand for patients. But on the other hand side is how to effectively stimulate the company and university partnership, and this is absolutely crucial. So we've started the project of partnering with universities, with both Warsaw University and with the technology transfer offices of various Polish universities to stimulate innovation, to find potential breakthrough innovation that could be co-developed by us. And then the COVID, on one hand side, it stimulated the interest in the partnership. On the other hand side, made it more difficult than ever because we needed to suddenly stop the contacts. We need to transfer all them into digital, and it's as we all know, not that effective as it used to be. So I think from a general perspective, the direction is clear, and I mean everyone knows both that the investment in healthcare sector is crucial, is very important, and the partnership between the companies who can deliver the solutions and the university and scientists who can invent them is crucial. The trick is how to make it more effective and how to stimulate it, and especially coming from the emerging Europe, how to make these breakthrough innovation coming from this part of the world.
Okay, well, if I can ask you, Miroslav, do you have any ideas as to how we could perhaps, make this more effective?
Well, first, there is one missing point in the regulation important for R&D, which is access to medical data for the research. In Poland, is prohibited even if you anonymize the data. So it's very difficult to conduct the research on a small, amount of data. That's the first point. Second, we have very rigid regulations for data security and privacy in Europe, right? Probably in the US it's less so, but in Europe it's very rigid, which also somewhat limits, for instance, adaptation, implementation of artificial intelligence systems, because those systems, as we know, can deliver really smart solutions if have access to lots of data. So this is the second. But there is again, I would like to conclude with some positive change in Poland. Recently, we started a new project, national cloud operator. Microsoft and Google are involved, and substantial investment. I've read that Microsoft is going to invest $1 billion for the cloud, and with cloud, with more processing power available remotely over internet, and at the lower cost, I look somewhat with optimism that in the future there will be more innovative solutions available.
Okay, Jan, I had a very interesting conversation last month with a colleague of yours at EIT Health, and we were talking about value-based healthcare. And without dwelling on COVID again, value-based healthcare is something which its cause has been greatly advanced by this crisis. But he made the point that it's investment is not just about money. It's also, as was just said, it's also about sharing data. I mean, is a lack of access to data something that you come across?
Absolutely. So I think, of course, if we're talking about now value-based healthcare, just briefly, I think there it's, of course, it's critical to understand and define outcomes really well, and also to make them comparable maybe, and for that, of course, data is important. But I think on a more general note, following up on what was just said, I think is for a lot of new technologies, the access to data is absolutely critical. And if Europe wants to remain competitive in the world, I think we do need to find a model. I would almost like to say that
is this something you think should be EU-wide? Should it be something that comes from the EU perhaps? Because there are countries, particularly in the emerging Europe region, where there are state monopolies on the data, and they really don't want to share it with anybody.
well, maybe not everything can be done from the EU, but I think that we need to, there's a few things. So one is, I think in Europe, there's a great opportunity because principally, I would argue that in a number of our healthcare systems, since they are often centralized, I think there is a lot of very, very valuable data there. They should be in high quality. So now I think what the EU can do is we need GDPR 2.0 for sure. We need to, there's a lot of things that make it risky and in some cases impossible to drive health innovation. So that's something for the EU to do. I think the EU, of course, has a big ambition with regard to things like creating this European health data space. Let's see what comes along there, but it's definitely understood that also enabling the creation and accessibility of large data sets of various types is absolutely important. But I think countries need to follow through. A lot of things are in the national domain. Once the right framework is created, I think they need to follow through. And then, of course, there are huge differences as to the type of data. I mean, whether we are now talking real world data that's generated in the clinic or whether we are talking about things like the 1 Million Genome Project or so. But I believe that for Europe, it will be critical success factor in the world next to China and the US. I think we still have the possibility to exercise leadership also on maybe on AI-based technologies in health. I think Europe is strong there and principally competitive. But if we don't act fast on the data side, we might lose that. And I know from a number of our partners in our network, also industrial partners, I mean, a lot of the AI-enabled solutions that will eventually be applied and, of course, also used in Europe are often developed in the US because it's easier to get hold of the data.
Mm-hmm.
And it's not cheap, and the quality is not always extraordinary, but it's at least possible. And I think we need to act there in Europe.
Anna, I've seen you with your hand up a couple of times. This is obviously something that you can relate to.
Yes, of course, and it's, it hasn't got that much to do with COVID anyway. This is the reality we're facing every day. We cannot live and work without collaboration. But maybe this is the moment when we really start to collaborate faster, like knowing how fast the solutions are needed. So no one can do it fast enough when you're alone. So at least in our case, we've started 4 or 5 new collaborations in the last 3 months, just to be able to fight with COVID faster. So yes, of course, I fully agree. And of course, the exchange of data is crucial, but I cannot say how the situation we are facing now will affect it in the future.
So do you not think that, some of the key stakeholders, and I'm, referring to the giant insurers, which are, in our region, usually the state, because it's usually the state health system that most people are subscribed to. Despite what's happened over the past few months, have they not got the message yet that, they really need to start collaborating with private enterprise a little bit more?
I think it's the last thing they are focusing on right now.
But they should be. No.
They should be, but they are filling in the holes at the moment. So yes, I hope this will be the lesson that will be learned, but not now. Now the focus is somewhere else. And this is a pity, but I just hope the lesson will be learned later.
Okay, Mikhail, I mean, when it comes to lessons learned, what does your company take forward from what's happened over the past few months?
I think it's that these couple of months changed tremendously the way we operate. So one learning is how essential is the drug supply to ensure continuous drug supply on a worldwide basis, which is dramatically complicated in when the borders are closed, when the traffic is limited, etc. On the other hand side, we learned how to enormously speed up the development process of medicines. It does come at a cost, that's for sure, because you take enormous risk doing things in parallel instead in the sequence. And also see it's not a learning from COVID. It's just a learning from recent years. But the own company R&D is not just enough. There should be a very extensive partnership, and the vaccine partnership between my company and a German company called BioNTech is just one example that neither company alone would be able to speed up the process of vaccine development the way that both companies did. And the same applies to company and university partnership. So it's even it's more important than it used to be before. So I think it's a great learning for us, and also that we need to be open to academics, and that probably it's easier said than done. It's not a one-time deal. It's building trust, building mutual trust, building mutual understanding, and establishing good platforms for exchanging of thoughts, ideas, and for sharing the data in a safe way. But these are like 3 or 4 main areas that I would just from top of my head that they change the way you operate very dramatically.
Mm-hmm. We've actually just had a question from somebody who's watching on the stream. Should this public health crisis reshape the pharmaceutical market into global collaborative research organizations? How do you feel about that?
I mean, it's not only this crisis. I mean, this is the process that we have been observing for quite some time. So the development of the drugs requires profound partnership with income of brilliant ideas, new concept, new discoveries. So it probably did not change it. It just speed up the process or made it more visible than it used to be. But for sure, this is the way that we are going forward.
Okay, if I can turn to your colleague there in the studio, to move away from COVID just a little bit. We've obviously got people here from private organisations, from businesses, basically. When we look at the US and then we look at Europe, do we in Europe now need to be a little bit less shy about seeing the healthcare sector as a business opportunity?
Well, probably we are a bit more careful, as I said previously, with data security and privacy. That's for sure. Whether it's bad or not, whether I would like to change it, it depends if I am a patient or if I am an innovator who wants to make a business using the data. So that's it. But I would like to add additional point, which I believe is valid for emerging or for Europe too, is the pace of the rollout of 5G networks. And why? Because in the future, with this more available bandwidth, this idea of Internet of Things will become a reality. All the devices, including medical devices, application with the care operators, electronic medical record systems will be interconnected. So in this moment, that should be a game changer for artificial intelligence. So for us in Europe, we should really take care that 5G networks are available on time. Otherwise, we will stay behind.
And how far behind are we? To a layperson such as myself, how far behind is the emerging European region when it comes to to the way that it approaches healthcare and innovation in healthcare as well? And how can we change that?
Well, again, investments and money is necessary. Licensing, if I know correctly, already were given. So it's going to happen. The only question is when. And another question is how we are going to use these new capabilities, combined again, if this national cloud project will be concluded successfully. That is going to be a game changer, because cloud, as we know, is opening new possibilities. So talking on these big milestones, cloud, more solution versus on cloud, more data available, artificial intelligence. I understand we are talking more long term. I'm not talking about today or next year, like 5-10 years ahead. And this long perspective we need to take in healthcare, because as we all know, innovation in healthcare is not that fast.
It takes
because
time.
doctors,
Yes.
it takes time. Doctors are accountable for the results of treatment. And even if you have a lot of various wearables, medical mobile devices, there is no standardization, no created standard medical procedures, how to deal with them. And if I were a doctor, of course, we are quite careful whether you really trust the data coming from these devices. So certification, standardization, access to the data, that would change the landscape in healthcare. COVID accelerated virtual care, definitely. But there is one missing point with virtual care, practical missing point from doctor perspective. Today, physical examination is not possible by phone or chat. So if we have a solution that you can operationalize, that you have virtual care, and if your doctor needs to see some vital signs, it is also available, then even more care could be delivered remotely, which would change dramatically. We need to have less clinics, the cost would drop, and for COVID and pandemic, it's natural. The more care delivered at home, the less risk for the patients and for medical personnel.
Okay, I'm gonna close with a couple of more questions that I'm receiving on the stream here. So these are questions that I'm going to put to the four of you, and if you could be as brief as possible, because we do need to wrap up at 22 on the dot. One of the questions that I've got is, which area of digital health are you most interested in seeing developed over the next few years? Let's start with you, Jan.
Well, difficult one. I think I believe
the difficult questions are the best questions.
No, I think an area that would improve, well, improving also, let's say, remote diagnostics and then also consultation. I think that would be, so if we are able to in a valid way transmit also vital signs, for example, that was just mentioned. So the areas where I have direct connectivity between the patient and the physician, I think that would be very good to improve.
Anna, briefly.
I would agree with Jan, but I would, as a medical doctor, I would say it would be a perfect tool for taking care of people from less developed regions. So I would not dehumanize everyday medical care, because it's absolutely essential to meet your doctor, and the physical examination is also very often essential, but we could take care of those who need it most.
Okay.
Thanks to telemedical systems.
Super. Thank you very much. It's a very good point coming from a doctor. Gentlemen in the studio, what do you think?
So as a physician myself, I believe the crucial point is to find the right place for digital remote healthcare. I mean, it cannot neither replace the regular contacts, nor can be this totally abandoned and just forgotten. So this is the crucial thing that we learned, that there is a lot of opportunities, as we discussed, with digitalization, but there is also a lot of risk, and we observe this. With patients being only able to contact doctors remotely, many of them probably suffer, and many of them are not receiving a proper healthcare for their diseases. So finding this right spot, I'm not sure which the spot is now, but finding this spot is probably crucial for the future of healthcare.
Okay, that's 10.
I would just add one point. Healthcare is complex itself, requires many years of studying, and it's becoming even more complex with all those technologies around cloud, mobile devices, whatever I was talking about. For me, it's quite easy to talk about those things because in my previous life, I worked for telecom operator. But what is really important is how we might or we could help all the medical professionals to understand all those new tools. That's really important. I don't think in medical schools today they teach how to find your place in this new world. And I believe there is a space for setting up professional knowledge and social kind of a network platforms for, but very professional with verified data for medical experts. So if they don't know something, they can always go there and talk to their peers and get the best up-to-the-date information. So that's developing the knowledge, helping them. That I believe also is a crucial thing.
All right. Thank you very, very much to all of my panelists. It's been a great discussion. I could go on for another hour, but unfortunately we have to end here because we now have the keynote address from Mircea Joana, the Deputy Secretary General of NATO, who will be speaking shortly, and then we will be jumping straight into the infrastructure and mobility session. Thank you very, very much indeed, everybody. Thank you.
Thank you all. Talk to you.